This is personal trainer Yuji. Everyone, I have a sudden question for you. How high can you shrug your shoulders? From a normal, natural state, how much can you raise your shoulders towards your ears? By the way, I've been told that I can raise mine quite a bit. And when I show this to my clients, they often respond with surprise, asking, wait, can you really raise them that high? It's often said that I don't understand, but I would like to accurately measure how high I can raise my shoulders right now. I want to use this wall over here to see how high I can go. So please stand next to me and try to align with it. Well, I'm in a natural state, neither raising nor lowering my shoulders, just in a natural position. In this state, I will place my shoulder here, at the upper part. Place your thumb on the upper part. Now, if you try to do this alone, it can be quite difficult. When you do this, sometimes the pectoral muscles and the biceps can get in the way, preventing you from moving in the right direction. If there is someone around, like a family member, please ask them to help you. Place your thumb at the top here. From this position, face forward and shrug your shoulders towards your ears. At the top here, about this much. You see, I've brought something to demonstrate. If we measure from here to here, well, I'm doing this honestly. So, let's measure it in my case. Well, it's not just a simple calculation, it's 10. It has risen 10 centimeters from here to here. How much have you all raised? Please give it a try. How was it? It went up. Was it not as high as you expected? Well, I think some people might be surprised at how much they can or cannot raise their shoulders. If the shoulders do not elevate much during the shrugging motion, it can significantly reduce the effectiveness of strength training, especially for the upper body. When the shoulders do not move or elevate properly, it limits the effectiveness of all upper body training. First, regarding the causes of limited shoulder elevation, if you look at this diagram, you can see the trapezius around the shoulder area. If the upper part of the trapezius does not contract properly, the shoulders will not rise. This is the primary cause. One reason for not being able to raise the shoulders is forgetting that the trapezius needs to contract. Next, there is the health reserve located deeper, which connects through the neck to the area above the clavicle. This also plays a role in lifting the shoulder blades. It feels like it doesn't properly contract and therefore doesn't rise. Especially when shrugging the shoulders, it shouldn't be done forward. Instead, it should come straight up. If you have the right posture, it should move towards the area behind the ear, specifically towards the back of the ear. However, if you do it forward, those who don't use their trapezius much tend to not engage in this movement. The trapezius is located slightly towards the back, so it's important to direct the movement towards the bone behind the ear. A good economy means that we can use it even more. Furthermore, if we rotate it this way, we can effectively utilize the health benefits and achieve proper contraction. The reason for not achieving this contraction is primarily due to the clavicle. The clavicle, as you all know, consists of two bones that extend laterally. In the center of the clavicle, there is a bump. The inner part of this area does not move much, so try touching it. You might feel it moving a bit. However, it does not move significantly. The range of motion is quite limited here. And it's not just in this area. The flexibility is also lacking on the other end where the shoulder connects. Because of this lack of flexibility in these two areas, both left and right, the shoulders cannot be raised properly. It's not just that the muscles are not contracting. The connective tissues that should be flexible have become stiff, which also contributes to the lack of movement. When these muscles do not contract or move, the upper body's movement does not function properly. For example, during the shoulder press, one might think that only the deltoid is being used. Isn't it wrong to engage the trapezius? Well, that's true. But the deltoid muscle, when it contracts, does so in a specific way. This is the maximum contraction. Even if you rotate your arm, the deltoid will still be engaged, but beyond this point. The entire shoulder joint begins to rotate, allowing the arm to rise. Therefore, when the arm goes above horizontal during the shoulder press, the shoulder joint must rotate. This means that the trapezius is contracting and the deltoid is also contracting. If these muscles do not contract properly, the rotation cannot occur, making it difficult to lift the arm forward. Consequently, the effectiveness of the shoulder press on the anterior deltoid is naturally diminished. Providing benefits means that effectiveness starts to diminish. For those who struggle with the shoulder press, the issue often lies in the fact that they don't regularly raise their arms, which leads to tightness in the latissimus dorsi. When performing exercises like pullovers, some people may feel discomfort in this area. If someone expresses that an exercise feels good, it indicates tightness. If the muscles were flexible, they wouldn't have such a strong reaction. People who do not engage in these movements are not raising their arms at all, so they spend a long time with their arms down. This can lead to a situation where, over 10 or 20 years, there is no opportunity for this side to stretch, resulting in tightness. This of course restricts movement. Then there's the back. In the case of the back, while there is also the trapezius involved, the issue with the clavicle is quite significant. The area I mentioned earlier, where the clavicle moves up and down, is not just about vertical movement. It also needs to move in all directions from this center. Please try moving it like this. While touching the center, rotate while feeling for this bulging area or the inside of it. This way, you move around this center. And during this movement, the edges should open up. But sometimes they don't. As a result, when doing exercises like rowing, the shoulders simply won't move back. It's not just because the trapezius is weak and doesn't contract, but also because it doesn't engage properly. The clavicle is stiff and prevents movement in this direction. It has become rigid, and if the clavicle does not move freely and softly, contraction cannot occur. Therefore, if it is not flexible, the range of motion will be significantly limited. Let's use this as a model for the lat pull-down. When performing the lat pull-down, just like with the shoulder press, if the areas here and here do not move freely, the shoulders will not be able to move properly. If this can move, then recently, you can still use your full range of motion, but if it doesn't move, it will stop here. Can you go further? Well, that's how the range of motion gets restricted. Furthermore, gentlemen, the beloved pectorals are also affected by this issue during dumbbell presses and bench presses. The current problem with the clavicle is that when you pull back like this with the serratus anterior, it moves in this way. The action of opening the front is necessary for the serratus anterior. And that is related to expanding the chest, which I always mention. He mentions that when creating the initial shape, if the shoulders cannot open properly, then he can only achieve half of the movement. From that point, it becomes easy for the shoulders to push forward. Therefore, if there is flexibility, particularly in the clavicle, the movement can be based on a different reference point rather than just this position. This means that the initial reference position is fundamentally incorrect. Without flexibility, it becomes difficult to develop the pectoral muscles. To avoid this situation, it's important to ensure that the shrugging motion can be performed to a certain height. For me, it was about 10 centimeters, but it should be close to that. When the shoulders can be raised adequately, it becomes easier to build the upper body muscles. As for what to do to achieve this, it's not that complicated. It's really not difficult. It starts with simply shrugging or rotating from the shrug position. It's about shrugging normally and then rotating. It's not just about the trapezius. I also want to ensure that the area around the clavicle is moving properly. While feeling the contraction of the overall muscle, I check whether this area is moving and opening correctly. This is what I will practice. I might focus on one side at a time, rotating it vigorously. While the trapezius will get tired, I will alternate sides to confirm whether the joint is moving properly. Now, while rotating the arms, make sure that it's not just the arms moving. Let's touch the clavicle here, shall we? While keeping your hand on this spot, we want to assert whether the movement of the shoulder joint, centered here, can be done properly. There are movements forward, backward, upward and downward, and it's important to be able to perform these large movements effectively. This rotation is about moving from this center point outward. I really want you to do things like this frequently. So whether it's doing the circular motion or just shrugging one shoulder, I want you to do it quite often. How often is frequently? It's not just once in a while. For those who currently have limited shoulder elevation, doing it once a day is not enough. To be honest, I would like you to do it 4 to 5 times a day. You can do it any time. It doesn't have to be right now, it can be whenever. It can be any time. But since I'm asking for 4 to 5 times, I really mean it. You can do it right after you wake up, while you're on the train or bus, just in a way that's not too noticeable to others. If you have a little gap, I want you to do it then. If you feel your shoulders getting tense while working, just shrug and lower them, and do it with the intention of moving your clavicle as well. Now, if you do it frequently, you'll see improvement. So it's better not to forget this and continue working in this state for days, months, or even years. It's a simple thing, but anyway, make sure to move properly. This will prepare your body for strength training. Only then will the weights and repetitions matter. If you focus solely on the weights, repetitions, or types of exercises without this preparation, you won't see balanced results. So first, let's get your body ready. All right, let's do our best. Please subscribe to the channel. I'm also on Instagram, so please follow me. This is personal trainer YUJI.